You do not have permission to record, let us know in the chat window, and we'll make sure to rectify that. We should be getting through that very shortly, and then we'll begin. The order for questions today will be Patty White from Maine Public Broadcasting, Hannah Deneen, News Center, Maine, Frank Rios, WMTW, David Horowitz, WVII, Brian Sullivan, WADI, Blair Best, WGME, Joe Lawler from Portland Press Herald, and from Bangor Daily News, we'll have David Marino. We'll get started in a minute, but first, let me go through and make sure everyone has permission to record, and then Dr. Jarvis, once I've done that, I'll give you the floor. Okay, it looks like we are just about all set. I think I've gotten everybody. If for some reason you're having trouble recording and you want to record, let me know. Okay, you should all have, oh, one more. Hold on, Dr. Jarvis. Okay, everybody should have permission to record. Dr. Jarvis, the floor is yours.
Thank you, Chris, and thank you, members of the media, for once again helping to share our message out there. As typical, we will start with some numbers. As of this morning, Northern Light Health was caring for 54 patients within our inpatients who are positive for COVID-19. 3 of those individuals are at A.R. Gould Hospital, 38 at Eastern Maine Medical Center, 1 at Maine Coast Hospital, 4 at Mayo Hospital, 7 at Mercy Hospital, and 1 at Sebasticook Valley Hospital. In addition, we are taking care of 7 individuals who are positive for COVID-19 at their home through our home care and hospice division. We've often talked about our positivity rate as kind of a marker for where the community spread is. And currently for Northern Light Health Labs, our 2-week positivity rate is now 9.92%, and our 1-week positivity rate is 10.13%. Those are considerably higher than the last time we spoke, and we continue to follow that on a regular basis. Last week, we began sharing an infographic on our social media pages that provides a snapshot in time of our number of hospitalized patients with COVID-19 and their vaccination status. We feel that the infographic provides important insight into the effectiveness of COVID-19 vaccines, and we're glad that it has generated a lot of discussion. We did not post it on Monday because of the holiday, but we will typically post it every Monday, Wednesday, and Friday. We will share a link to today's graphic in the chat. A few questions have been asked repeatedly on social media, and I can provide a couple of points of clarity. People have asked if those noted as vaccinated in the graphic are fully vaccinated, meaning 2 weeks have passed since their final dose. However, this graphic includes fully vaccinated people as well as any patient who has had at least 1 dose of COVID vaccine in the vaccinated category. People have asked why Mayo Hospital and home care and hospice are not included. We haven't included these because as the newest member of the system, Mayo Hospital is on a different version of our electronic health record, and their information does not get pulled into the report that we use to create the infographic. Home care and hospice is not included because they are on a different electronic health record and because their patients are not considered inpatients. We have been asked if the people represented in the infographic are hospitalized specifically for COVID-19 or if they came in for something else and tested positive for COVID-19 after arrival at the hospital. The answer is that both groups are included. Anyone in our hospitals who has tested positive for COVID-19 while in the hospital is included, though the bulk of the COVID-19 positive patients are in the hospital because they need to be treated for COVID-19. We've also been asked if patients represented in the infographic have comorbidities. At any given time, some, but not all, may have comorbidities. We don't currently report this data to the community. What we can tell you is that people who are being hospitalized now with COVID-19 are younger on average than they were in last fall and winter, and on the whole have fewer comorbidities. The one thing that most of them have in common is that they are not vaccinated. We know that vaccination continues to prevent severe hospitalizations and death, and if you're thinking about getting vaccinated, now is the time to take that next step. The vaccine is available at pharmacies, from healthcare providers, at many walk-in care sites, and some community events. And I'll turn it over to Paul for a quick message.
Thanks, Dr. Jarvis. So just a brief update. In our last update, I provided the forecast that I anticipated our employee vaccination rate to be at 90% by that long weekend, and we did surpass that number through the end of the weekend. We're at 90.1%, and we'll continue to update that as we go. We continue to provide vaccine to our staff who are interested in becoming vaccinated, as well as education and support for those who still continue to have questions or any hesitancy, and to help them navigate through fact versus some of the social media and other fiction that's out there, that we need to continually provide that level of support and to reinforce some of the facts that Dr. Jarvis just mentioned. And we continue to work on those issues, along with taking care of our patients and all of the other typical operations at Northern Light.
Thank you for that update, Paul. Very important for us all to understand that healthcare workers are getting vaccinated. Due to increasing demand for COVID-19 testing, most Northern Light Health testing sites offering state testing, testing for community members with COVID-19 symptoms, and some pre-procedural testing will transition back to centralized swab and go locations. Because testing sites around the state will transition on different days, member organizations will be sharing information locally, and we encourage people to visit the Northern Light Health website at northernlighthealth.org/testing for up-to-date local testing site locations. Online scheduling for the new testing sites will go live on September 9th. For those without internet access, scheduling and registration can be completed by calling 844-489-1822 from 9 a.m. to 5:30 p.m. Monday through Friday. Please note that long distance charges may apply. All sites will offer self-swab testing, and accompanying adults should be prepared to swab children under the age of 12 with guidance. As far as vaccine boosters go, we continue to wait for the direction from the FDA on third booster doses for the general public. It appears that approval for the third doses of the Pfizer vaccine will come first, followed by Moderna. We will monitor development closely and be ready to vaccinate our communities at the appropriate time. Even though vaccines against COVID-19 remain highly effective after 8 months, booster doses are being considered because, as with other vaccines, the COVID-19 vaccine's protection against diseases will decrease over time due to waning immunity. In the case of COVID-19, the strength of the Delta variant may also have an impact. It is important to note that certain individuals who have weakened immune systems are currently eligible for a third dose as part of their original series. If you feel that you fall into this category, please reach out to your provider. Specific criteria must be met, but if you qualify, you can get your third dose right away. Before we get to questions, I'd like to remind everyone that while COVID-19 continues to be a significant concern, it's important to remember that preventative care and treatment and maintenance of other health issues continues. One of the most important things you can do to stay healthy is to not delay care. Our hospitals are safe, and our care teams are here for you when you need us. If you have put off preventative care, now is a great time to schedule an appointment. If you are not feeling well, call your doctor. The steps that you take now will benefit you long after the pandemic is over. And with that, I'll turn it over to Chris to start questions.
Thank you very much, Dr. Jarvis and Paul. We're going to start off today with Patty White from Maine Public. Patty, why don't you go ahead when you're ready and unmute yourself and ask away.
Great, thanks so much. Can you just tell us a little bit more about the capacity at your hospitals, what the strain is like, and what you're seeing in patients? What's kind of the same in terms of what you're seeing with the surge, and maybe what's changed?
Yeah, so Patty, that's a great question about what our capacity issues and what we've seen change about the patients who are being admitted for COVID-19. So as far as capacity issues, again, this is the time of the year where we always have capacity issues across the state of Maine. And so this year is no different. It's an ever-changing target for us. I can come in first thing in the morning and we have few beds available, but through the miraculous work of our staff, our doctors, and our nurses, we have been able to meet the demands of our communities across the entire state. But it is a concern for us as we continue to see additional care that's needed for people with COVID-19. It is a concern that we need to continue to monitor for capacity. Right now, we can continue as we have been and take care of all of the needs of our communities, including taking care of people with COVID-19. But if it was to get any worse, that will be something that we will have to continue to reflect on. As far as the differences that we're seeing in the individuals who are with COVID-19, as I said before, they are tending to trend younger than we saw before. and they are requiring a lot more critical care resources than we saw in a year ago. And what I mean by that is that these are individuals who are requiring high-level intensive care. Often they require 2 nurses for 1 patient, and that would be the opposite of what our typical staffing model would be. And they're requiring a lot more intervention than we had to do with individuals before. So once again, the single best way that you can avoid having to be in our hospitals for COVID-19 and to help assist us in our capacity issues is to get vaccinated. So therefore, you will not need to take a bed away from somebody else who needs one. So thank you for that great question, Patty.
Thanks very much. And Paul, can you give us an update on how many employees have decided to leave their positions over the vaccine requirement?
Sure. So we've got about 35 people who've already left us over the course of the past few weeks, starting first with the state requirement for flu shots, and then shortly after that for the decision to mandate COVID vaccine. We have about 100 or so who have indicated that they intend to leave, but some of those have changed their minds. So we know that's a fluid number. So the largest group of our unvaccinated are the folks who haven't identified what they're going to do. And I think that indicates that there is some very personal decision-making going on with that unvaccinated population, which is opportunity for us to provide that fact support for them and give them answers to questions that some of them continue to have. We still hear some very general questions that would be consistent with the types of things that Dr. Jarvis mentions here on a weekly basis. And so some of it is just a matter of getting the right information to people through the myriad ways that we communicate with our staff. But we continue that effort and are optimistic that most who are unvaccinated will ultimately decide to become vaccinated.
Thank you very much for those questions, Patty. We're going to move on to New Center, Maine right now. And I believe it's Hannah Deneen. Is Hannah out there? I see New Center, Maine in the chat window. If that's not Hannah, could you unmute yourself and let me know if you're asking questions? Okay, we're going to move on. Next up, we're going to have WMTW. It's Frank Rios, but he said he's having trouble with his microphone. We've got a couple of technical difficulties, it looks like, today, but he sent me 2 questions to ask, so I'll do that on behalf of WMTW. And I believe this question is probably going to be for you, Dr. Jarvis, as the patient question. How many Northern Light Health patients are vaccinated, and what percentage of Northern Light? And then I guess the other question is for you, Paul, that second part of that, what percentage of Northern Light workers are vaccinated?
Yeah, so I don't have a particular answer to that first question. If you're talking about all of the patients that we cover under Northern Light Health, we do know that here in the state of Maine, 75% of individuals who are eligible for vaccine are completely vaccinated, and that's wonderful news for all of us. But beyond that, I don't have specifics around our individual patients across all of the system. What we can say is, as the infographic shows, about 90% of the individuals who are hospitalized are unvaccinated. So.
And the second part of that question, as of the last count, we had 90.1% of our employee population is vaccinated. We do know that there's a group of about 100 who have indicated in the last several days that they did receive their initial dose of vaccine at a non-Northern Light location, and so we're validating those data with the employees. So we would expect that 90.1 to go up in the coming days. And
Dr. Jarvis, this is another question probably for you, but it's probably readily available on the infographic. And what percentage of patients in the ICU were vaccinated? But that might be in the infographic, right?
It is on the infographic. We did put that out there. I will say that, of the sickest of our patients in our intensive care units, as of this morning, only 1 was fully vaccinated. All the rest of them were unvaccinated.
Okay. Those are the questions from WMTW. David Horowitz also having trouble with his microphone. He's next on the list, but he gave me the question to ask, and this one is for you, Dr. Jarvis. And the question is, what do we know about the Mu variant, and are you seeing that with your patients?
Yeah, so as we talked about before, testing for particular variants or the genomic component for particular variants is not something that we do on a regular basis. And there's a couple of reasons for that. One, it's a fairly expensive and intricate test to do. And two, it rarely provides any clinical information, meaning that we treat individuals who have the original strain, the alpha strain, the delta strain, and if we needed to, the mu strain, very similarly. So knowing that is more of an exercise in knowing what's circulating out in the community. I have not heard any updates from the state of Maine, which does random sample testing for variants to see whether or not that includes any mu strain. But from us, from a clinical standpoint, that has not been something that has affected us here in Maine. It is something that we continue to watch, and the World Health Organization has designated it as a variant of concern, meaning that they are watching it, that it could become something that has a dramatic effect. But right now, it is still the Delta variant that is the major and predominant strain that we're seeing now and causing most of the disease that we see. Thank you for that.
Okay, and next up, we're going to move to Brian Sullivan, and hopefully Brian doesn't have the technical issues.
Can you guys hear me?
We
Yep.
can, Brian.
There we go. Okay, I have one for each. Dr. Jarvis, I'll start with you. Maybe a little bit of what you talked about with Patty, but the numbers that you gave out in terms of positivity rates that you're dealing with, can you take that back to a time as to when you had those numbers previously, or is that higher than what you'd seen throughout the pandemic? And any thoughts of the elective surgeries? Are those going to be pushed back, or are those still being scheduled as regularly planned?
So two very good questions. So yesterday, our 2-week positivity rate actually had tipped above 10%. I don't recall that it was that high any other time during the pandemic. If it was, this is still close to a record high, meaning that transmission amongst people in the community is extremely high. If you remember way back in the very beginning of the pandemic, and I know that seems so long ago, we talked about going across a 1% 2-week positivity rate was concerning. When we hit a 3% positivity rate, we knew that we were going to have a large increase in hospitalizations. And that's what we saw last November that preceded the December and January spike. Now we're talking about a 10% positivity rate. So, that means that COVID is in and about pretty much every community that Northern Light Health serves. And so we need to be aware of that, and we need to protect ourselves from that. And I'm sorry, the second question was about scheduled procedures. So as a matter of course, we do review all non-urgent procedures to make sure that one, it is being done in a timely fashion, and two, if it's a possibility to delay a particular procedure because it has a high likelihood of resulting in hospitalization, can we do so safely? So right now we are doing that on a regular basis and reviewing all of those. We have not had to have any wide-scale delay or curtailing of elective or non-urgent procedures. We've been able to manage those. We have had a few case by case where we've delayed for a bit of time, but that has not been our process so far. We hope that we will not have to do that. But like I said, we are continuing to evaluate, and capacity concerns always are what we need to look at, and we need to take care of our most urgent cases first. And so, if we continue to see these increases in COVID-19 hospitalizations, we may have to look at that as being part of our process in order to maintain capacity. So thank you for that, Brian.
Okay, and one for Paul, if you could just swing the camera over. Thank you so much. Paul, you gave out some numbers, and I'm just trying to wrap my mind around a little bit. So you said 35 have left, 100 have indicated that they are planning to leave, and then maybe another 100 have said that they're getting the first dose. So I just wonder, of that 90 of the 9.9% that are unvaccinated, how many does that make up? And after how many does that make up? And after the FDA approval of the Pfizer vaccine and the 4-week sort of extension before they're going to check in on you guys, what did you see from your employees after that news came out?
Sure. So we've got about 12,500 employees. So just a little bit less than 10% are yet to be vaccinated. So 9.9% still need to become vaccinated. So that's about 1,200 people. And so of that group, the numbers that you mentioned are what we have for information. So the biggest group of the unvaccinated staff are those who haven't decided what they're doing, or at least haven't told us what their plans are. And we continue to work with them in particular to identify what concerns they might have, to try to provide clinical experts such as Dr. Jarvis, our infectious disease professionals, and others to provide information to them to answer the questions that they have. And it really is, in many cases, a one-on-one conversation. I myself have even taken some of my own team members to sit with them as a support person while they get vaccinated and wait their 15 minutes post-vaccine before they leave the vaccination site. So it's really a very personal decision for many employees, and we're trying to meet them where they are in terms of answering questions and concerns that they have.
Thank you for your questions, Brian. Next up is Blair Best from WGME.
Hi, good afternoon. Can you hear me?
Yes, we can, Blair.
Okay, perfect. I heard you say that you did have to delay a few of the elective surgeries to make more room for COVID patients. What sort of consequences will this have for those patients who have their surgeries delayed now?
Yeah, so it just depends on the rationale or the reason for it. So remember, I didn't use the word elective surgeries. I said non-urgent procedures, and there's a distinct difference there. When we talk about elective surgeries, most people think of things like knee replacements, plastic surgery, and the like. And so we prefer the term non-urgent procedures because there are other procedures that don't need to be done immediately, and some procedures that we purposely delay for particular medical reasons. For any of those people, though, it does add to their own personal anxiety. They are expecting to get something done and can't get it done. And we know that there are hospitals around the country that have had to delay a large portion of their non-urgent procedures due to high volumes of COVID-19. And that's just an added stress to any individual that happens to. And we're trying to avoid that as much as possible. If this is a matter of concern for you, and I hope that it is, then you need to do the things to keep yourself out of the hospital and keep the people that surround you out of the hospital. And that includes wearing a mask while indoors, maintaining appropriate physical distancing, washing our hands frequently, and if you're not yet vaccinated and you're eligible, to get vaccinated.
Perfect, thank you.
Thank you, Blair.
Okay, so next up, we're going to move on to the Portland Press Herald, and that's Joe Lawler.
Yes, hi, thank you. Just continuing on with the non-urgent surgeries. Maine Med or Maine Health told me yesterday that up to 30% of their elective, non-urgent procedures are being delayed. Is that similar to what you're seeing, or is it less because for reasons that have nothing to do with COVID? Can you explain that?
Yeah, so at Northern Light Health, we don't even have a percentage to talk about. It has been a rare occurrence that we have had to delay a particular procedure, and particularly due to the fact of our capacity issues due to COVID-19. So I want to be clear, we have not been doing that on a very regular basis or anything that's statistically significant. That may change. We certainly feel for our colleagues at Maine Health, and we support them in any way that we can. And as they do for us, Maine is a wonderful network of health systems and hospitals and private practices that have all joined together to help us overcome any difficulties we've had during this pandemic. But currently, we are not seeing the need for us to delay in any significant numbers, but that could change. And that's the thing that's so important. We don't want to get to that point. We don't want to be over the edge or over the precipice. What we want to do is prevent us from even having that get done. And the only way that can happen is to have decreased amount of COVID activity in our communities. And the only way that can happen is with those things that I continue to talk about. Wear your mask, wash your hands, stay physically distant, get vaccinated.
Okay, and my next question is if we could just discuss a little bit more about the 10% positivity rate, which I believe is the last time I had seen the statewide rate, it was about 5%. So that's pretty much double the state rate. In the past, have your numbers been frequently tracking higher than the state average, or is this more unusual that it's been tracking higher? And if it is unusual, can you explain why you think it's higher than the state average?
Yeah, that's an absolutely excellent question. And so we typically track a little bit higher because at one point the state was not only running tests for clinical reasons, but they were also running them for travel, and we expected that those tests would come back negative. as most people did not actually have the disease. We spend the most of our testing is on people who are symptomatic or coming into hospitals for other reasons. And therefore, yes, we have always tracked a bit higher. I do think that the state's average, once they get through tabulating everything from the long holiday weekend, will probably tick up to somewhere in the 7 or 8%. That's what it looked like from the numbers that I saw yesterday on the state's website. And so I'd refer you back to the state for their most up-to-date numbers. But yes, we traditionally would track a little bit higher than the state simply because we're testing more people on a clinical basis than they were.
Thanks so much for your questions, Joe. We're going to move on now. I think last on the list is David Marino from Bangor Daily News. David, when you're ready, go ahead.
Sure, thanks. These questions are both for Dr. Jarvis. You touched on this a little bit, but do you have a plan to resurrect the drive-through testing sites? Or do you otherwise have plans to restore testing capacity to what it used to be?
Yeah, so right now we are testing more numbers than we ever had during the entire pandemic. So I want to be clear, we have already exceeded what we have done before, so we continue to do that. But most of that is now for clinical reasons. And I know that there are people who are frustrated out there because they have they need tests for travel requirements and the like, and that's becoming exceedingly difficult to find with an appropriate turnaround time. But as I stated, we are going to resume having our swab and go sites. So those will be those drive-through and drive-up testing sites across our system. That will be launched later this week. And again, for people just need to look at their local communities to see if and when that particular site will be open for you. And again, we can share the web link as well as the phone number that viewers and listeners can reach out to find out how to schedule a test for clinical reasons.
Okay, and I believe you have one more follow-up question. You should be able to ask it, David.
Great. At what point would you institute a widespread delay in medically necessary procedures to free up capacity at your hospitals due to COVID-19 cases?
Yeah, so initially when we talked about having to delay procedures, it was simply because we didn't know a lot about COVID-19 and how to protect ourselves and our staff. We know a whole lot more how to do that. And so now most non-urgent procedures are done on an outpatient basis, and we feel we can continue to provide those. It's the ones that would require hospitalization and that we would have to readdress as our capacity issues became more dire. And that's what we do now on a pretty much an hourly basis, is checking in to see what capacity issues we have in order to meet the demands of our communities and the region. Eastern Maine Medical Center serves a very large geographic area. It handles most of the heart attack victims, most of the motor vehicle accidents, and a significant portion of children who are sick. And we want to maintain those services. And so we would have to look at prioritizing non-urgent procedures that may result in hospitalization so that we can keep beds open for those other things and events if we were filled with COVID-19 patients positive for COVID-19. Right now, we do not have to do that, but we continue to evaluate that on a daily, if not hourly basis.
Okay, thank you for those questions, David. I do have one more quick point of clarity for Paul. This came from Brian Sullivan, Paul, and it was about the employees.
Sure.
And he wanted to clarify, is it fair to say around 1,000 employees at Northern Light Health are unsure of what decision they'll make on vaccination?
No, I would say that 1,000 employees haven't told us what their inclination is. So I'm not sure if they're unsure, if they're waiting for their own reasons. With the state moving the deadline, some originally were waiting for the September 17th deadline to receive the J&J vaccine. So I think there are a number of reasons that employees could have done that. So I wouldn't say that 1,000 people are uncertain. They just haven't disclosed to us what their plans are. And we continue to work with them to identify what, if any, questions they have and identify what their plans are.
Okay, thank you very much, Paul. Thank you very much, Dr. Jarvis. That's going to wrap up our media briefing. Do you have any closing thoughts before we let everyone go, Dr. Jarvis or Paul?
Once again, I just want to say thank you for getting our message out there. It is so important. Maine continues to lead the way in so many categories, but unfortunately, one of the things that we are leading now in is positivity rates for the New England area. And the percent of our positive cases that are children. And so, again, anything that you can do to help us and to assist us in taking care of our communities is so appreciated. Wear your mask while indoors, wash those hands frequently, remain physically distanced, and get vaccinated. Thank you.
Thank you.
Thank you all.